This segment is brought to you by IBV International Vaults, world's most exclusive private vaults.
Taz, thank you so much for joining us on Living Your Best Life.
Thank you, Maria. Thanks for having me.
So one of the most important things, and yet we take it for granted every single day, is body posture.
Absolutely, very much taken for granted. And posture is so important in terms of how we project ourselves. Happy people have upright, erect, positive posture, and you can tell the way somebody feels and looks just by their posture. It's as simple as that.
So what do you think are some of the conditions that affect body posture?
Posture is affected by so many variables, and we can start simply by mood, as I said earlier, but other big variables would be your occupational things like ergonomics, the way you sit at your desk, the way you hold and work with your computer. For example, if we take a secretary that's sitting at her office on a laptop and not on a desktop, you'll find her head is tilted forward, her shoulders are rounded, she's sitting, she would get an awkward pelvic tilt, her hamstrings will tighten. Then you get somebody like a painter who would also be affected because a painter is working with his arm. If he's right-handed, he's working with his right hand. He's looking up, he's working across diagonal planes. So all those factors will affect the rotation on the spine. It will affect the way he walks, the way he stands, and the way he looks. So there's many variables that do affect posture.
I think one of the things that affect mothers mostly is that we have kids that are sitting in front of their iPads, in front of the computers, and they're slouching. How can we help these children better upright their bodies?
Good question. I would say take those laptops and cell phones away. But I think most importantly is to teach them to hold the phone or the iPad at eye view so that we're not getting a head tilt. Get them to sit upright. Very important. So we're not getting that leaning forward, the rounding of the shoulders, the forward head poke. So those are the little things that make the difference. But Maria, it's so important to limit that time.
So which are the muscles that are involved in correct posture?
So if we look at from the head moving down, you've got muscles in your neck that are very, very important and very often neglected in terms of posture. So you're looking at your anterior muscles, which if very tight, is going to pull your neck forward. Okay, so that a lot of rotational movement and correction of that in terms of stretches will help correct that. And your anterior muscles in terms of your chest, when they start to tighten and shorten because of slouching, it will give you this kind of look. So the minute you get that kind of look, you're going to get your pelvis that tilts anteriorly. So what happens then is your lower back muscles, your hamstrings, your glutes, your hip flexors all start to shorten and tighten. And then the most important part is when your long stabilizing muscles in your spine get very tight and very lazy, then they don't hold your body upright. So the most important muscle though is your transversus abdominis, which is your core muscle, which is almost non-existent in a lot of people, but that's the muscle that needs to start working to start slinging and stabilizing the spine.
So I understand that you're going to show us a few exercises to help us strengthen our core.
Absolutely, looking forward to doing it right now. So what I'm going to do is I'm going to teach you how to stretch your hamstrings. So I want you to lie down on the mat for me. And we're going to use the TheraBand. But people at home can use a tie, a belt, a towel, anything that will allow you to hook it around your feet and hold it in your hands. So what I'm going to do is I'm going to take one of your legs, hook the TheraBand around it and ask you to hold this in your hand. So place your other leg straight down for me, and this one's going to be nice and straight. So you're going to hold this upright for at least 20 counts. So remember, a stretch needs to be held for at least 20 seconds for that stretch reflex to be activated. So you'll hold it for 20 seconds, take it down and lift it up again, holding it for another 20 seconds and dropping it down. You can do that about 3 times, and you'll do that on each side. So the next thing I'm going to ask you to do is take one knee into your chest for me, please, and hug it nice and tight. You're going to bring the other one up nice and slowly and hug both of them. So wrap your arms nice and big around your legs and give yourself a big hug. And that should stretch your muscles throughout your mid-back, into the bum and the hamstrings and the neck muscles. So drop your chin into your chest for me, holding it again for 20 counts and relax out of it slowly. Lovely. So can I please ask you to lie on your side, face to perfect. Okay, excellent. So now what I want you to do is bend your knees. Lovely. Now Maria, the hand that's under your head, take it and place it onto your knee. So all we're going to do from here is take this hand and stretch out for me and follow your arms. So this stretches the front of your chest, the spine, and throughout the hip. Remember when we chatted earlier, we did say that the front of the chest, the anterior aspect of the body, takes a lot of strain and shortening with the hunching of the shoulders. So we'll go back to the center and open up for me one more time. And each time you're going through the movement, you're going to go a little bit further and further. Do you feel the stretch into the spine and the chest? Excellent. Now take your hands back for me and relax.
This segment is brought to you by IBV International Vaults, world's most exclusive private vaults.